Hello, welcome to the Pharmacology of ANS Part 1. The first question says, choose the correct combination of statement from the following. So statement P says that hemicolinium prevents the release of acetylcholine from storage vesicles. Then the botulinum increases the acetylcholine release. Vesamicol inhibits the uptake of choline and organophosphate inhibits acetylcholine esterase. So we have four options here, that is A, B, C and D. Let's look at their solution. So the solution is option C, that is P, Q, R are false statements but the S1 is true. So how P is a false statement? They have said hemicolinium prevents the release of acetylcholine from storage vesicles. However, we should know that hemicolinium, it blocks the choline uptake and depletes the acetylcholine amount in our vesicles. Then we have vesamicol. So vesamicol inhibits the uptake of choline, but the actual function of vesamicol is it blocks the active transport of acetylcholine into the synaptic vesicles. Then they have said botulinum increases the acetylcholine release. However, the function of botulinum toxin is that it inhibits the release of acetylcholine. So all the three statements, that is P, Q and R, are false. Only the S1, that is organophosphate inhibits acetylcholine esterase, is true because it irreversibly binds to the acetylcholine esterase enzyme and increases the amount of acetylcholine and thereby modulates its actions. Next question. The diagnosis of myasthenia gravis is by using which of the following? So the options are edrophonium, succinylcholine, neostigmine or atropine. So the solution here is option A, that is edrophonium. So remember, for the diagnostic test of myasthenia gravis, we have an ameliorative test. So in this test, initially edrophonium of 2 milligrams is injected intravenously as a test dose. Okay, if after giving edrophonium nothing happens, the remaining 8 milligram is injected after 30 to 60 seconds. So what happens is the reversal of weakness and short-lasting improvement in the strength of affected muscles, it will occur only in the myasthenia gravis patients and not in the ones which are suffering from muscular dystrophies. So this is how we can differentiate between the myasthenia gravis and muscular dystrophy patients. Next question, beta blocker causes all except. So here we have the four options, that is decreases heart rate, increase intraocular tension, decrease the cardiac work or bronchoconstriction. The solution is option B, that is increase intraocular tension. So remember, beta blockers, yes, decrease our heart rate. For example, that we have all the beta blockers, that is timolol and propranolol. Then we have option C as decrease cardiac work. Yes, after decreasing the heart rate, they will decrease the cardiac output and they also cause bronchoconstriction. Only they won't cause increase in the intraocular tension, they will cause a decrease in the intraocular tension. And some beta blockers are used for the treatment of glaucoma as it reduces the intraocular tension. So the example here is timolol. Next question. Here are some of the statements about beta blocker. Let's look at them one by one. First statement is atenolol is longer acting than metoprolol. Second statement, labetalol has both blocking actions. Next, carvedilol has beta-1 agonistic and selective alpha-1 blocking action, and nadolol has the shortest half-life. Now from all these four statements, we need to choose the correct combination of statements. So the solution here is option B, that is PQ is true while RS is false. So remember the drug that we have, that is carvedilol, okay, it is a beta-1, beta-2 and alpha-1 adrenoceptor blocker, and it produces vasodilation due to the alpha-1 blocking activity, as well as calcium channel blocker it is, and it has antioxidant property. Also, carvedilol has been used in the hypertension and is the beta blocker especially employed as a cardioprotective in congestive heart failure. That's why R is a false statement. They have given carvedilol is a beta-1 agonist and selective alpha-1 antagonist. But no, it is a beta-1, beta-2 and alpha-1 blocker. Then we have the statement S as nadolol, which has the shortest half-life they are saying. Also this statement is a false one because the half-life of nadolol is 20 to 24 hours and we can give its dose once daily. So we also know that the shortest half-life of the beta blocker is esmolol and not nadolol. Hence S statement is the false one. Next question. The drug of choice for uterine relaxant is very easy question this is, because there is only one example for the uterine relaxant. The options here are ritodrin, salbutamol, isoxsuprine or terbutaline. So the answer is option A, that is ritodrin. There is only one example as I said. So ritodrin, it is a short acting beta-2 receptor stimulant, okay, and it is a preferred drug of choice for uterine relaxant in order to delay the premature labor. Then the other examples that we have, that is salbutamol, isoxsuprine and terbutaline. These are also the beta-2 receptor stimulants, but they are not the drug of choice for uterine relaxation. Hence the correct option here is option A, ritodrin. Next question is the mechanism of action of atropine is. So here we have four options, that is competitive ganglion blocker, competitive muscarinic blocker, competitive neuromuscular blocker or non-competitive neuromuscular blocker. So the correct option here is competitive muscarinic blocker. Okay, so atropine is an anticholinergic drug, that is it will antagonize the actions of acetylcholine and it is acting on the muscarinic receptors and not on the nicotinic receptors. Hence it is also called as muscarinic receptor antagonist. And the anticholinergic drugs, remember that is an example of atropine, they are also called as parasympathomimetics. Anticholinergic drugs, they are also called as parasympathomimetics. Next question, indicating the long-acting topical decongestant agent is. So the options are epinephrine, norepinephrine, phenylephrine or xylometazoline. The correct option for a long-acting topical decongestant agent is xylometazoline, which is an imidazoline compound. It is a relatively selective alpha-2 agonist. Okay, so it is a decongestant agent, alpha-2 agonist, and it shows the longer duration of action than ephedrine. It is used as a nasal decongestant agent and also it is a topical route of administration. Next question, sand eyes are due to which anti-glaucoma drugs? So the options are apraclonidine, latanoprost, pilocarpine or timolol. So the correct option here is option B, that is latanoprost. So latanoprost is instilled in the eye. It is a PGF2 alpha derivative and has efficacy as similar to timolol. Okay, and it reduces the intraocular tension by about 25 to 30%. And its effect is also well sustained over long term. So latanoprost, it reduces the intraocular tension in the normal pressure glaucoma. Next question, which has maximum nicotinic effect? And the options are bethanchol, carbachol, pilocarpine or methacholine. So the maximum nicotinic action you can see in this table, it is shown by carbachol. See here, carbachol shows maximum nicotinic effect, while the bethanchol that we have, it has negligible effect on the nicotinic receptor but more selective action on the muscarinic ones. Okay. So this table would be easier for you all to remember. That is acetylcholine, it gets hydrolyzed by all the esterases that we have, and then methacholine, it has more of muscarinic action and lesser nicotinic action. However, carbachol has more of nicotinic effect and bethanchol has more of muscarinic effect. Next question, which of the following cranial nerves does not contain preganglionic parasympathetic fibers? So they are asking not. So which one of these does not contain the parasympathetic fibers? The options are oculomotor, facial, optic or glossopharyngeal nerves. So the solution for this question is option C, that is optic nerves do not contain preganglionic parasympathetic fibers. So remember, there are only 4 nerves which will serve these fibers. Those are 3, 7, 9th and 10th one, that is oculomotor, facial, glossopharyngeal and vagus nerves respectively. Next question, which of the following drug is used to reverse the effect of tuberculosis? The options include atropine, physostigmine, organophosphates or the neostigmine. Now, we should know that the Tubocurarin is a non-depolarizing competitive antagonist, okay, which will act at the nicotinic acetylcholine receptor, and it is a skeletal muscle relaxant. That is why it will cause relaxation of the skeletal muscles. Now they are asking which is the drug used to reverse the action of tubocurarin. So we have first option as atropine. So atropine is an anticholinergic drug which will act on the muscarinic receptor and not on the nicotinic receptor. Then we have physostigmine, which will inhibit the acetylcholine esterase enzyme and thereby it will हमारे acetylcholine को वो metabolize होने नहीं देगा and it will stimulate the acetylcholine action. फिर we have organophosphate, वो irreversibly bind करेगा acetylcholine esterase enzyme को and वो breakdown of ACH को नहीं होने देगा. It will prevent its breakdown. So the most appropriate answer is option D, that is neostigmine, because it is a carbamate derivative, okay, and it is a reversible anticholinesterase. अगर वो reversible anticholinesterase है, it is used to reverse the effect of muscle relaxants like tubocurarin. So the correct option here is option D, that is neostigmine. Next question, test for myasthenia gravis is. So the options here are provocative test, ameliorative test, succinylcholine, or option D, both A and B. So you can refer for a detailed explanation, you can refer to this page number. So the correct option here amongst all four is option D, that is both A and B are correct. For myasthenia gravis diagnostic test, we have ameliorative test, provocative test and anti-NR antibody detection test in the plasma or muscle biopsy. So remember, ameliorative and provocative tests are important for the diagnostic test of myasthenia gravis. Next question. A 3-year-old child is seen with coma, weakness, salivation and one-sided constricted pupil. Okay, this is your keyword, that is salivation, that is there is increase in the release of secretions. The most probable diagnosis is, the options include tetanus, organophosphorus poisoning, phenobarbital poisoning, or the electrolyte imbalance. So the solution for this question is organophosphorus poisoning, option B, occurring, and यहाँ पर salivation बढ़ रहा है, weakness and constricted pupil are the effects that are to be seen after acetylcholine esterase is inhibited irreversibly. That is, they are literally damaging the acetylcholine esterase enzyme. Next question, the drug of choice for mushroom poisoning is. Options include adrenaline, physostigmine, atropine, or carbachol. So the solution is option C, that is atropine. So muscarin type early mushroom poisoning, it is caused due to inocybe and related species. The symptoms characteristic of muscarinic actions, it appears within an hour of eating the mushroom and these are reversed only and only by atropine. Next question is, which of the following is an M1 blocker? Okay, so muscarinic M1 receptor blocker कौन सा है इसमें से? Pirenzepine, atropine, probanthine और esmolol. So esmolol is तो directly eliminated because it is a beta blocker. Let's look at the solution for this question. So you need to know the M1, that is muscarinic receptors. You need to know its classification. So this is the table here. Let's go to the examples. The agonists are oxytrymorin, methacholine and bithancol. But the antagonists are pirenzepine, tilenzepine, methotrexate or triptramine, or solifenacin and darifenacin. As they have asked M1 receptor blocker, you can see we have pirenzepine and tilenzepine, that is option A. Pirenzepine is the answer. So you can just look at this table, memorize the examples, and it will solve a lot of MCQ questions. Next question, which is the strongest acting mydriatic? The options include atropine, tropicamide, cyclopentolate or homatropine. Now what is mydriatic? So the mydriatic drugs, it will make the pupil of the eye to dilate. So if the pupil dilates, it will open up and it will tend to relax the focusing muscles of the eye. And in doing this, the blurred vision is a common side effect of using the mydriatic drugs. So the solution here, the strongest acting mydriatic, it is atropine. So atropine is a potent mydriatic agent, but its slow and long lasting action is undesirable for refraction testing. Then, though the pupil dilate for 30 to 40 minutes, cycloplegia, it takes 1 to 3 hours and the subject is visually handicapped for about a week on using an atropine. And the substitutes attempt to overcome these difficulties. That is, the other drugs that we are going to administer along with atropine, they are going to eliminate these problems. So the correct option, strongest acting, is option A, atropine. Next question, which of the following drugs does not produce, so they are asking, does not produce central anticholinergic syndrome? The options are atropine, glycopyrrolate, antihistaminics or tricyclic antidepressants. So the solution here is option B, that is glycopyrrolate. So remember, atropine, tricyclic antidepressants and the antihistamines, all these three classes of drugs, they will show anticholinergic action. But glycopyrrolate that we have, it is a peripherally acting anticholinergic, and so it does not show the central anticholinergic syndrome. Next question, what is the half-life of dobutamine? The options are 120 seconds, 220 seconds or 20 minutes. So the correct option for the half-life of dobutamine is 120 seconds. And remember, dobutamine is a direct acting sympathomimetic agent. It is a beta-1 agonist. Being a beta-1 agonist, it will have a cardiac stimulant action and it causes inotropic effect on heart. Next question. Which of the following is an indirectly acting sympathomimetic? For this, you need to know all the drug classifications of ANS. The options here are adrenaline, tyramine, phenylephrine or clonidine. So the solution is option B, that is tyramine. So the indirect acting sympathomimetics, they will act on the adrenergic neurons to release the noradrenaline, and which then acts on the adrenergic receptors. That is why they are called as indirect acting sympathomimetics. So the examples include tyramine and amphetamine. So remember these two drugs. These are the indirect acting adrenergic. Then the other options, that is adrenaline, phenylephrine and clonidine. These are the examples of direct acting sympathomimetics. And what do? वो लोग directly adrenergic receptors पर जाकर अपना action दिखाएंगे. Instead of the neurons, they will act at the receptor level. That is why they are the directly acting ones. Next question. All of the following are true except. So we need to find out the false statement. The first statement says that IV noradrenaline increases systolic and decreases diastolic blood pressure and cause tachycardia, that is increase in the blood pressure. Then IV adrenaline increases systolic, decreases diastolic blood pressure and causes tachycardia. Next statement says that isoproterenol causes no change in the systolic, decreases diastolic blood pressure and causes tachycardia. And the fourth statement says that dopamine decreases peripheral resistance and improves renal perfusion. So let's look at its solution. First, let's see what they have to say regarding all the drugs. We have IV noradrenaline, which is an alpha 1, alpha 2 and beta 1 agonist. Okay, so it is alpha 1, alpha 2 and beta 1 agonist. Noradrenaline जो है डायरेक्ट स्टिमुलेंट इफेक्ट दिखाता है at the cardiac level because of the beta 1 receptors. It constricts all the blood vessels. So because we have alpha 1 receptor over there, and the systolic, diastolic and pulse pressure, all three are increased. Because stimulating effect है तो सब कुछ increase होगा, blood pressure भी increase होगा. Okay, then let's talk about adrenaline. So adrenaline, what does it do? It will act on the alpha 1, alpha 2, beta 1, beta 2 and beta 3 receptor. So remember, जो adrenaline है, it is the prototypic drug in case of the adrenergic mimetics. Then it is a cardiac stimulant. It interacts with the beta 1 receptors and produces positive chronotropic, positive inotropic and positive dromotropic effect. And if adrenaline is rapidly injected intravenously, what will it do? वो both systolic as well as diastolic blood pressures को increase करेगा. Okay. Then we have isoproterenol as an IV. It is a beta 1, beta 2 and beta 3 agonist. So it is just acting on the beta receptors. It is a powerful cardiac stimulant, has positive inotropic, chronotropic and dromotropic effects, and it causes no change in the systolic, but it decreases the diastolic and causes tachycardia. Tachycardia, that is increase in the heart rate and increase in the blood pressure. Then we have dopamine. So dopamine is a relatively selective beta-1 agonist. It decreases the peripheral resistance and improves the renal perfusion. So these are all the 4 statements that are justified over here. And the false statement from the given question is only option B, that is they have given adrenaline increases systolic, decreases diastolic and causes tachycardia. No, it will increase both systolic as well as the diastolic blood pressure because it acts on all the receptors of adrenergic neurons. Next question, Dale's vasomotor reversal is due to. So we have 4 options, that is stimulation of alpha 1 or alpha 2 or beta 1 or beta 2 receptors. So the solution is option D, that is stimulation of beta 2 receptors will lead to the reversal of Dale's vasomotor. So alpha blockers which are there, it will abolish the pressor action of adrenaline. Okay, alpha blockers obviously they will antagonize the action of adrenaline, जिसकी वजह से क्या होगा, fall in blood pressure due to the beta 2 receptor mediated vasodilation. Okay, एक receptor को antagonize करने की वजह से there is beta 2 receptor mediated vasodilation and this is called as vasomotor reversal of Dale. So it is due to the stimulation of beta 2 receptors. Next question, ezerine is another name for. So we have the options as physostigmine, neostigmine, edrophonium or pyridostigmine. The correct option is option A, that is physostigmine, which naturally occurs in the calabar bean. So ezerine, it is derived from ezer, which is from the West African name for calabar bean. It is an alkaloid which is obtained from the dried ripe seed of Physostigma venenosum. And this is the another name for ezerine. Next question. Effect of dopamine on kidney is blocked by. So effect of dopamine is blocked by which of the following drugs? That is pindolol, propranolol, haloperidol or esmolol. So the correct option here is haloperidol. It is neuroleptic. So the term neuroleptic is applied to chlorpromazine or a haloperidol like conventional antipsychotic drugs. So these two drugs have potent D2 receptor blocking activity, that is they will block the dopamine receptor. Next question. Following is an example of nerve gas. So the options are tabun, sarin, soman or all of the above. So remember, all the given options are nerve gas and they are the irreversible anticholinesterases and they are also used in the chemical warfare. So remember the organophosphates that we have, which are the irreversible anticholinesterases. These were used in the chemical warfare. Next question. Which of the following is not given in a patient with pheochromocytoma? So the options here are atenolol, prazosin, sodium nitroprusside or metirosin. So the drug which is not given in a patient with pheochromocytoma is atenolol. Hence the correct option is A. So pheochromocytoma, here beta blockers may be used to control tachycardia and arrhythmia, but it should never be administered, okay, unless an alpha blocker has been given before. Otherwise what will happen, अगर दोनों blockers हमने साथ में दिया, a dangerous rise in BP can occur. Hence directly atenolol कभी नहीं देना चाहिए. Thank you so much.